You are listening to the Julie Parker Practice Success Podcast, where you discover management insights and strategies for your successful dental practice. There are also interviews with key people in the industry who have advice and services to help you and your team achieve great success. Welcome to this episode of the Julie Parker Practice Success Podcast. And today I'm delighted to be joined with Specialist Prosthodontist and founder of the Advanced Dentistry Institute, Dr Yohan Thomas. Thank you so much for joining me today.
Thanks, Julie. Great to be on your podcast. Thanks for having me as well.
My pleasure. I've had a little bit of insight into the kind of work that you do because of your fantastic practice manager, Sally Lumber.
Yeah, great.
And yeah, she's an absolute powerhouse herself. But your life, I figure, I assume, is extraordinarily busy. So first of all, before we get into the Advanced Dentistry Institute, tell us a little bit about you, what made you do dentistry, what made you specialise, and then eventually what made you start this huge undertaking of establishing Advanced Dentistry Institute.
Okay, that's going back a few years, my age, but I think always the intention was for me to try and look after people and put a smile on people's faces. And initially I thought I was going to do medicine. And yeah, lo and behold, I didn't get the grades or I didn't cut it. So dentistry was something I fell into. Now, when I did dentistry, I never thought I would be a prosthodontist. But if you can believe, when I've got into 50, I thought, maybe I would be a pediatric dentist.
Gosh, wildly different.
Yeah. What was I thinking? I don't know. But came here to do my undergrad and then my specialist training. But when I finished undergrad and I got into private practice, I realized, wait a minute, treating kids in general dental world is a completely different ball game as compared to when you're teaching them in school, dental school. All right, and so then I said, all right, no, I don't think it's for me. And the next best thing that I could think of was, what can I do to put a smile on people's faces? And that was to do pros. So I finished pros from Adelaide in 2006. Going back 2007, December. And I got into specialist private practice. I was working with another prosthodontist here in Adelaide. And then in 2010, I branched out onto my own. And so I love what I do in terms of, yes, it puts a smile on people's faces, but for me, what gets me going is what people find difficult, I like taking on. Or if people say, nah, can't be done, I'll say, let's give it a go to see if it's possible. And that's where I go.
That's a beautiful mindset to have.
Yeah.
A lot of people do, though. You know, we turn away the minute we feel that we can't find the answer straight away or we're not competent enough to be able to do the thing. We turn away from that. But to be able to face into that and go, no, there's going to be a way. And there's a great saying that I heard from somewhere years ago saying everything's figure-outable. But you've got that mentality that there has to be a way forward with this. And so congratulations on having that kind of mindset. And I suppose that was the kind of mindset that you needed in order to start something so enormous as the Advanced Dentistry Institute.
Advanced Dentistry Institute, or ADI as we call it, was birthed out of a completely different need. It sort of morphed into this thing. So ADI actually started off 11 years ago, but it wasn't any institute. So when I finished my specialist training in Adelaide, we were not taught how to do implant dentistry, all right, as a prosthodontist. We got some bare bits and pieces here, but we were never shown how to do the implant surgical side. So once I started working with a prosthodontist here in Adelaide who was doing a fair amount of implant surgical work, I found myself lacking. And so then I started looking around, where can I go? Meaning the prosthodontist was trying to teach me, but it's very different when you're learning at work. So I was trying to look around, traveled around looking for places. I'm a kind of person that likes to be taught face to face. And if it's in a classroom scenario, I lose stuff or I get distracted or I get intimidated. Let's put it that way. Somebody's better than me or I'm not as good as them. So I'd like to always learn in a one-on-one setting, and that set it off. And when I traveled around and found where I want to set it up, and work with the university, which is what we do, I decided that whoever I take for the course structure will always be unique, where it will always be a one-on-one system. So irrespective of number of students we have, so even if we have 20, every candidate will be assigned a personal mentor to teach them, so that there's no sharing, there's no waiting, and there's no one sort of peering over your back and saying, ooh, I wouldn't do that more. And then you get conscious and you sort of, it just makes it difficult. So I guess ADI started off trying to help me. And then a friend said, oh, can I come and do what you did? And then another friend said so, and then slowly it sort of snowballed, one thing into another thing. And then ADI sort of set itself up just before COVID, and then we shut shop for COVID, which was a real tough season because there was no travel, there was no education, everything was online, and we weren't set up online because we're face to face. We're live patient training. And so yeah, so that's in a nutshell. ADI started to help me, and now I'm helping other people. And so, hey, great.
Magnificent. And quite often this is exactly how great ideas come about. Because there's a need. We see a need, and we need to fulfill that need. And it does remind me of the great Buckminster Fuller. Have you ever heard of Buckminster Fuller in your travels? No. So he was an American. He died in 1980, and I think he was in his 80s or 90s when he passed away. But he was such a brilliant, brilliant man. He actually earned 43 honorary doctorates. He was such a brilliant human being.
Wow.
And he's extraordinary. It's extraordinary that not everyone knows about him, but this is one of the lessons that he taught, that we have to identify the need that we're going to fulfill in the world, and that's our responsibility to fulfill that need. And so congratulations to you for identifying that. Now, I was listening to, I've known about you for a while because of Sally, because she did our practice management course. And then I heard you on Angus Pryor's podcast, which for everyone out there, it's a fantastic podcast. I listen to it every single week. I think it's called Practice Growth HQ. Yes. And you were mentioning to Angus that you were looking for where to actually conduct this kind of training where you're going to be able to work on live humans in an ethical way. And the place that you settled into was in Chennai in India. Tell us about that journey.
So basically, if you can't tell, I'm from India. And so when I came here to study, there was never any thought to go back. And so when the quest started for me to find where am I going to set up the program, I went into Thailand, I went into Cambodia, where else did I go? I went New Zealand. I pretty much went everywhere I could think of where the learning could be translatable. And I just didn't find, and then I went to different universities in India, into the capital and everywhere else. And then finally I came back to this university, which is down south in Chennai, and they had no program themselves. But what they were willing to do was work with me to create something that I would be happy to sort of train other people with or offer it to other people. Again, it was only started for me to go. And then a friend of mine came, Sam from Adelaide came, 11 years ago. And he said, Yohan, I'll come with you. I'll come and see, and I don't know how to do implants. You're going to learn, I'll come with you. And Sam came with me, and the two of us did the course together. And I can proudly say we're still friends today.
Quite an accomplishment.
So Chennai came about because Chennai is it's considered the Detroit of Asia. It's all the car manufacturing companies. It's a lot of expats. Everybody lives. It's a very cosmopolitan city. It's the size of Victoria, but it has 26 million people there. All right. Yeah. But education is one of the main things the whole state is known for. And everything is taught in English. And the university, the head of the university, trained in Harvard, and he's done his MBA also from Harvard. So he was always looking for ways to grow this dental school, to improve its scale. So I think that's where I came down and I settled, because they were willing to help me. They wanted, and they were sort of say, let's do anything we can to get this program up and running. So that's how it started. So the program, from being a one-chair program now, is a 10-chair program now. Let's put it that way. And
Fantastic.
we've got a purpose-built clinic as well. So that shows whatever money they were charging me, they were actually putting it back into the program to build the facilities and everything else. So yeah.
That's a great, great thing. And it does show how these sort of things is kind of, they do evolve. If you
Yep.
knew all the things that you would have had to have organized at the very start, you may not have done it. Because I imagine there have been challenges all the way along. You know, every big project does have challenges all the way along. But what you've got now is something that you're enormously proud of. You've had many, many students come through. How many students have moved through over the last few years?
I could say roughly around maybe 300 students
Yeah.
already, over 200 to 300. I guess I can't put a figure because what we teach is not just implants. We are actually doing surgical extractions, wisdom teeth, impaction cases as well, but also rotary endodontics. All right. And so we take a few people across, but we still stick to what we started with. It's a one-on-one concept.
And that one-on-one concept, I mean, I know that everyone learns in different ways, but I imagine a lot of people learn very, very well in that framework. And having this 5-day intensive, it's reminding me of, it's a full immersion experience.
Yep.
And it really does make a transformation within you. So you come in, and I was reading some of the reviews from dentists that have completed the course. And one of them in particular said, I was nervous, capital, nervous coming in, and then to be able to have that transformation within that 5-day period and come out and feel that level of confidence. How confident are students feeling when they're completed the course? For the implants, for example, or all of it, actually, all of it.
I mean, I think it basically depends on the personality of the person who's coming. So we do phone interviews and discussions before we go. And there are some candidates who I tell them, hey, listen, this may not be ready just yet. Maybe you need a little bit more experience before you come in. But with the implants, we take beginners. Surgical extraction, we can take people who don't like doing extraction. So we fit it, we customize it for each person, and so I guess when I have a chat with them, have a discussion, we know where they are at. And then we have a chat and say, we'd like to see you grow 1, 2, 3, 4, 5 steps before you finish the course. And I guess most of the time, because we've been doing it the same kind of thing again and again, we sort of have an understanding of how to sort of take the students through. And usually what happens is the first day they come, they are nervous, they're scared, new place, new environment, but we try and help them settle in as quickly as we can. I'm there at every batch. I oversee every case. I oversee every student. I oversee every case. And I'm constantly involved in the process of saying, hey, how are you going? What do you need? Or what are you struggling with? And then I relay that back to the mentors as well. Even though the mentors, they all do the whole course is in English, sometimes students are nervous to say, oh, sir or doctor, I'm sort of not sure how to raise a flap. I'm not sure how to, put the drill here or there. They just go with it because they're shown everything all the way. And so then that's relayed back. And so the next day onwards, they start focusing on what they're nervous about. And so we try and go through their pain points of what they're struggling with on a daily basis, but we have the system sort of fairly well laid out that you come in at one end, depending on your experience level. When you finish, you can come safely back to Australia, New Zealand, wherever you're from, and place implants in simple cases. All righty. And that's the main thing. We're not, and I always have this saying, I'm not here to teach someone to become a specialist in 5 days. We're giving you skills that you never had before so that you can start the starting step or the first step for another 10 steps in your journey. Journey to a marathon, it starts with the first step, so that's what they do. So that's how we try and get them through that. We allay their fears. We're there with them. We're literally holding their hand. And if anything goes wrong, we let them know it's not your responsibility. It's the mentor's responsibility or mine, because that's how all the candidates are legally registered to work on patients as well. It's not a backyard course. They all have registration with the Dental Council, as students of the university for 5 days. Alrighty, so that puts the fears down, and then we work through that step by step, getting them through. Some struggle, hey, I've never done an implant before, but That's what you're here for. Some say, listen, I've done a little bit of extraction, but I've not done surgical. All right, teach you how to do the next step by step. Practice makes perfect. All righty. And that's what we try and do in an intensive of 5 days, is just the same thing again and again and again, and get to the stage where by the last day, what we try and do is the mentor he's there in the room, but he hasn't gloved up. All righty, because they feel confident enough for the candidate to run on their own. But if they feel something is wrong, they put their hand on the shoulder, say, stop, can I just jump in and have a look? And they do that. It's to keep the patient safe as well. We don't treat the patients like guinea pigs as well. They are a human being. And that sort of helps the students realize, wait a minute, I'm in a safe environment. Providing a safe learning environment is so crucial, where you're not thrown under the bus, And I've been to courses, there's 20 of us, there's somebody in the front saying, do this, do that. And you get distracted because you're overwhelmed and you lose step 3, 4. And then you start, whoa, what do I do? And then you're trying to wing it. Nah, there's nothing like that here.
And I really, I've never been a practitioner. I've had a history in as dental assisting, reception, all the things. I had my own practice for 10 years. And I've always been the observer of the practitioner going about their thing. And I've always thought, gosh, there's so many opportunities for panic to set in.
Yep.
You're the only one in the room who can do anything about this. The extraction or the whatever is not going according to plan. And so we can certainly get in our own way. I've always been, I think I've worked with a lot of great dentists because I've always admired the way they have functioned under pressure. I've never seen anyone kind of freak out. But just like with your dental degree to become a dentist, that was the starting point. That was this kind of just allowed you enough information and education to be able to start treating patients one-on-one. But then that's where the intense learning starts happening as well.
Absolutely.
And creating that kind of environment where it embraces the fact you're going to feel incompetent, embraces the fact that you're not confident in any of these areas yet. And it's the amount of preparation and guidance that is required in order to be completely open to learning.
Yep.
So when they do come out, they do have that level of confidence to go back into their surgeries and have this learning make a difference. And as you say, start them on the next 1 to 10 steps to get to the next level.
Yep. So, meaning it's really crucial, and that's why we have a chat with the candidates, or I have a chat. So once the candidates register, then it's sort of, we say, all right, let's have a chat to see where they're at, what are they looking to do? Because we may not be the course what they're looking to do, alrighty. We may not be at the level of what they're trying to do. Some may say, listen, I just don't want to go overseas. Fair enough, that's fine. So we have a chat to get an understanding of their competency level, their skill level. It isn't a negating factor, but it's just to set up the standard for us so that we know how much of support they're going to need. And that's all it is for. Not everyone who applies and registers with us do we take across. We've got to say, hey, listen, let's wait. And I guess at the end of the day, all I'm looking for as a course coordinator or a director or whatever of the program is, are you willing to be taught? What I don't want, and we've had in the initial days, we've had some cowboys come through. All right, nah, I know what to do. Nah, I know what to do. Nah, I know what to do. And so, you're going into a setting where the mentor is sort of coming down to your level. And if you start saying that, the mentor thinks, wait a minute, am I looking like I don't know what I'm trying to teach you? Or they start being overconfident, becoming arrogant. So I think that's what we look for. Skill level is not a limiting factor. No skill, but your heart and your drive is to learn and want to be taught and willing to be taught and willing to taught. All right, this is the way to do it, not this way, do it this way, do it that way. Then perfect. Then your trajectory is like that. Otherwise, it's just like you're not going to get anything because you're not willing to absorb anything.
Yeah, you're getting in your own way. Yeah, and not allowing it, not being on the journey.
Yep.
And so you mentioned earlier something that made me think that a new grad may not be the best candidate for the course, that you'd like them to be in the field a little bit longer than that. Talk to a little bit about that.
So we've tested all the extremes in terms of the number of candidates we've taken, so I have taken, so I've got a friend in Tassie, who I've taken, she graduated December, and then we took her in February or April, we took her. Alrighty. And that's again only because I taught her in dental school when she was doing undergrad. I knew her personality, that you tell her, she listens, and then she says, takes it on board, and then she does what she can. She stops and says, Dr. Thomas, what do I need to do? How do I need to correct it? So I knew her personality was she would listen and she would be willing to be taught. So yes, some new grads need to get their feet into the water of real life dentistry rather than public dentistry. And then that's where I tell them, listen, maybe 6 months wait, or 12 months wait, and then come in. But even if they're a new grad, we have the course system set up even for new grads to come and do it along the way. So it's not a limiting factor, but generally we say, listen, give yourself 6 months at least so that you get an understanding of how to talk to patients. I guess that's the biggest challenge. Doing the course is one thing, coming back and talking to patients and having that confidence to tell them, hey, I can do this. If you're not confident to tell them, I can do a crown prep, alrighty, there's no point in trying to tell them I can do an implant. So
yeah, absolutely. So because you do have different focuses with your different courses, implants, surgical extractions, rotary endo, etc., are they all separate 5-day courses?
Yeah, so they all run at the same time. Alrighty, they run at the same time. So let's say this week we have the implant course. So they run at different levels in the university, on different floors, because the university is so huge. And so every level they have a different course. So the top level is implant. Level 1 is the endo level. So level 2 is endo. Level 1 is surgical extraction. So I keep moving between the floors, and so everything runs at the same time in a 5-week block. But sometimes we've had candidates who come week 1, they do surgical extraction, and we're there for usually 2 weeks or 3 weeks because we have different cohorts that come through. And so week 1, they come in and they do the surgical extraction, and then they stay on for another week more, and they do the beginner's implant course, or they do the endo, or sometimes they come and do the beginner's implant week 1, and then we have a different level course. They do the intermediate or the advanced implant course in week 2. So there's different ways to do it, but it all happens at the same time. And we've tried to stick to a 5-day model where it's limited time off from work. You fly out of Australia, because they're the same day, all right, and then you leave India, and then you're back here within 12 hours or less, So yeah, so that's how it all runs at the same time in the same week. We run the courses February, April, and August. And people say, why can't you run anymore? I'd love to, but unfortunately, the weather gets in the way. All right, so that's the only reason. So February is fine. Give a little bit of a break so that my family doesn't disown me. So and come back in April. But May is peak summer. Alrighty, May and halfway through June. But end of June and July is monsoon. And if people who know Darwin, when it rains, it floods. Alrighty, and so that's May. So June and July. So we go back in August. August and September is okay, but end of September onwards, a monsoon sets in. So October, November is monsoon season, alrighty, and they just had a floods couple of weeks last week, literally. So the whole city came to a standstill. Everything was stuck. My friends who were there for holidays were stuck in the hotels.
Wow.
So yeah, so there's no point going when you can't get to dental school. Staying in the hotel, nah. And then December, nobody wants to go. So that's how we've picked those dates. So we started with 1 week each time. Now we're up to 2 weeks. In some cases, we do 3 weeks in February or 3 weeks in August. So just depending on what's required, we stretch that bit out.
Beautiful. And so what does the journey look like for the student themselves? Once they've gone through the application process and have had conversations and they've been deemed, yep, fantastic, you're in, then they take a week off work, at least 1 week off work. Yep. They fly in, and you provide accommodation is all part of the package. Yep. Tell us more about that journey for them.
So once they usually book in for a discovery call. All right, that will be the easiest and the safest if they already haven't heard from friends. So people who've heard and word of mouth, they just book in. All righty. But even every single candidate, I touch base with them on a phone call, and then we have a Zoom session as well as a group just before we go. So the course packages are designed in such a way that, if you're from that part of the world, you know where to stay and you want to stay, all you have to do is pay the course fees. Alrighty, but some people say, yes, I'm from a different part of India, but I don't know where I'll come and stay with you guys. We all stay in a 5-star hotel. Alrighty, 5-star hotels in India, like 7-star hotels here. Alrighty,
wow. Treated nice.
for the price of a 4-star hotel here.
Wow, even better.
Even better. So we stay in the same hotel. So we all, so they get a package of either a comprehensive package, which includes the course fee, accommodation, airport transfers, daily transfers to the university and back, and a couple of dinners there as well. Alrighty, or dinners pretty much because they're only there for 4 nights or 5 nights, depending on what. So, and then a bit of sightseeing here and there. Alrighty. But again, everyone depends. So sightseeing, we let them do what they want to do. But that's the course package that we can try and do a comprehensive or just a course fee alone. We used to do airfares, but then everybody said, oh, my dates are this, but wait a minute. No, my mom said she can't come. No, my husband wants to come. Oh, my sister's fallen sick, so I can change that. We used to do, all right, and started getting gray hair, so I had to cut my hair shorter. All righty, so I said, no more airfares, let them do it. And so all we do tell them is try and be a day before, and you can leave on the day the course finishes. So Friday the course finishes, there's flights out that night, and some people or most people fly out that night. So they're back in Australia by Saturday.
Amazing, amazingly powerful stuff. And how many people are within each cohort?
So in each cohort, you get around 10 to 15 people. Alrighty. So there's five or six for the implant. There's 5 for the surgical extraction, and maybe 2 or 3 for the rotary endo. So we've started a different course, a crown and bridge course as well as a denture course. Alrighty. So we're taking only small numbers there, 1 or 2, just to sort of get them into the flow of things. But we all go together. When we come back, we all decide, do we want to go out sightseeing or do we want to go out and have a bite? The only thing I tell them is, please don't go and eat street food. All righty. If you don't want to be...
You need to be healthy enough for tomorrow.
I say 3 days that, just have to make sure that you stay. So Monday, Tuesday, Wednesday, or 4 days, because Friday is like a overflow day. If we've got patients who haven't come, there's always backup patients who are booked in. So 5th day. So yeah, we just try to tell them, be safe, what you eat. I'm there. I guide them, and stuff like that. We have a debrief session at the end of each day. And then we decide, do we want to go out sightseeing? Do we want to go out for a meal together? Some people say, no, I'm going to stay. I'm going for a spa. I'm going to this massage, or I'm going shopping, and so each person does their own thing, but I guide them where to go. But usually people now, every day, everyone can just check on, Google and what's the best place to go to them. So yeah, so that's how, when we go together in the morning, we come back together in the evening. It's a fairly long day. We leave at around 8:15, 8:30. We're back around 5:30. But because it's mentally intensive, so people get tired. So usually this is interesting. On the first day, everyone's talking and everyone's, yeah. Oh, where are you from? And getting to know each other, and then at the end of the day, this day, you hear at the end of the day, everyone's quiet because it's like, whoa, what happened today? Second day also like that. By the third day, when they're coming back in the evening, everyone's like,
totally exhausted.
Tired. And I've got photos, first day, third day, on the way back from dental school, how they are. But, by the first day, they're always like, whoa, like deer in headlights. All right. And by the third day, they start to see a little bit of, sparkle in their eyes. And by the fourth day, they think, wow, like I've had candidates who've come and said, I don't know what I'm doing here. I'm not good enough. I shouldn't have come now. And I said, no, take your time, pace yourself. It's only the first day. So the same thing happens, a little less on the second day. The third day, you can start to see a glimmer of hope there. At the end of the third day, they will say, I can understand what you mean. And I love it. What I'm doing, I'm learning. It makes sense. It's clicking into place. On the fourth day, they say, yep, it makes sense now. I think I can do this when I go back. So you start to see that click, click, click happen as they go, each day goes by.
It's just such a wonderful thing to acknowledge what that learning journey looks like, what learning a new skill that you are, it's completely, even though you're a dentist, it's completely foreign. You haven't done this sort of thing in the past. And that sense of overwhelm that we all get when we are knee deep in incompetency, conscious incompetence, we're so in it and we're so uncomfortable with it. And we think, I'm not going to be able to get there. I can't get there. And to be able to see people superimpose themselves over to that side, and that's where life becomes extraordinarily exciting. And if we give ourselves as many opportunities to go through that, then we become very comfortable with those feelings of incompetency, because we understand it's just temporary. Until I learn more things and do more things, it's temporary. And the more I learn, the more I do, that's the shorter length of time as possible that I can make that feeling of incompetency exist within myself that's making me so uncomfortable.
That's so true, Julie, and so, you just reminded me of something that we do as well. So we start them on the journey. So if everyone's concern is they come there, they do the course, come back, and then they're left on their own. So what we've done in the last 8 months or so is we've taken it to the next level, that when candidates come back, so they have this intense support while they're there, for 5 days, and they get a lot of information. So what we've decided now is when they come back now is we do a mentorship Saturday. So one Saturday every month, we come together as a group. We predetermine who is going to present cases, alrighty, and talk about cases. And so basically that time is what they were doing at the course, where their mentor was telling them, all right, this is the case. What are you going to do? And let's see what you do. We do that online on a Zoom or a WhatsApp call, and we talk and discuss cases among ourselves, and we help the candidates get set up for their surgery. So that's the mentorship, and that happens once a month on a Saturday that's predetermined for 1 hour. That's all you need, and from there, what we've had candidates now is come and say, oh, I'm still not 100% sure. I'm 80% sure I can do this. So now what we've just recently launched, and we've got our first candidate happening, is we're now starting for some candidates, if they get in early enough, because it's me and Sally. We're only one here. We're doing on-site mentoring. Alrighty. So the way our course structure works is we have module 1 or level 1, which is a hands-on restorative. And if you sign up to do the surgical program, that hands-on course is heavily discounted. I got to check with Sally. It's actually almost free. Alrighty. So that's almost $1,200 value there for that day. Come for the course. When they come back, they've got Saturday mentorship. But now we've said is we'll go on-site mentoring, where for some candidates, we predetermine me and Sally go there on the day they're going to be placing implants. Mm-hmm. And I actually hold their hand and guide them through the process of what they were doing at the course. So they have 3 cases or 4 cases, alrighty. And then Sally helps their team get set up in terms of the nursing side, ordering stock, how to set up the room, the debrief, all of that. So it's just one day, we're there, we show you. And some say, so I've got a candidate now who came for the course in August and from Melbourne, and she wants us to do it. So we're going there in November. And I've got a candidate who came for our restorative course in February this year, or earlier this year, sometime April, I think. And she's in Cairns. Alrighty. So she wants us to go there to do on-site mentoring as well. So we're doing that next year. So we're happy to travel, but we've got to get it early enough to know that we can block it to be able to do it. There's a fee for that on-site mentoring, which is completely different, and that we'll sort of discuss it with the candidates when they're ready to go there. So they're not left on their own anymore when they come back. We're trying to create a community of people that will work together, talk together, and discuss cases and help each other grow step by step.
That's extraordinary. And I was going to say, when you all go, that cohort goes over there together, that feels like this, community, tribe-like. You're linked with these people like you're not linked with any other people in the world. And to maintain that then with your monthly mentoring sessions via Zoom or WhatsApp, that further establishes those relationships where you do get a bit of a brains trust that you can tap into whenever you need it.
Absolutely.
But to be able to go on site, we are really bridging that gap between, I know the stuff, but I don't have the confidence to do it yet. You're really bridging that gap, which is extraordinary, because while you're doing all of this, you still have your own practice.
Yes. Yes, I do. So unfortunately, as a prosthodontist, I haven't got anybody to come and help me. So if anyone listens and they want to join,
That's in South Australia, everyone, in Wavell, South Australia.
Yeah. So but so then the clinic is shut, so it's a bit of give and take, you can't have it all, Yes, I'd love to sort of be able to do both at the same time, but something's got to give for me to be able to do this. But teaching has always been something where my heart's been, and that's what we're working towards. So, even with the WhatsApp call and the Zoom, we haven't set it up to the stage where everyone's coming on, but we actually do one-on-one. So even yesterday I had candidates messaging me and saying, hey, these are my cases, then send them back messages, talk to them and discuss their cases rather than doing it on a Saturday. But this is all the plans in the pipeline of what we want to be doing going forward.
It feels like, but years ago when I met my second husband, one of the first pieces of advice he gave me has still stuck with me today. He said, "What would happen if you just didn't put up any resistance to anything?" And I'm like, "Oh my God, I don't even know what that looks like." And just becoming aware of it made me realize how much I did used to put up resistance to all sorts of different things. And it feels like you are the type that you move through your world without that level of resistance. Otherwise, the continued communications with your students who have, gone through the course in the past, you'd be like, "Oh, I don't have time for this." And, there's all these reasons why I can't be away from my own practice. And they might need further assistance and support after they come back from Chennai, but who's got that kind of time? It feels like you are constantly delivered reasons to put up resistance, or a lot of people would be putting up resistance. And so you're leaving it within this box. Advanced Dentistry Institute is within this little box, but it feels like there is no box there. That due to the fact that you are, what else, how else can this be improved? What else do people need? It just blows the lid off what it's, evolving into.
It's so true, meaning it's easy to, I always think that there's 100 reasons why you shouldn't, alrighty, but I try and say, is there one reason why I should, or I could, or I can help somebody? That's all it comes down to, alrighty. Sadly, our world has become very selfish, if that's the right, I'm trying to think of the right word. We've become very insulated. It's me, the old Jim Carrey movie, me, myself, and Irene. Alrighty. We've just become enveloped in this. And so for me, I think I'm not like that. I want to be able to give out. Giving out does come at a price, but I'm thinking, hey, wait a minute. If we structure it in such a way that, even the course that we run, patients, the candidates who come, all they have to do is place 3 implants. They've recovered the course fee.
Wow.
Alrighty. And even the on-site mentoring. And so that's how we say, we don't want it to be unachievable for somebody who comes, we want it to be within reach, so ADI was never designed to be a box, but I guess it does have limitations. I'm one person. Alrighty. So there are days, yes, I would say that I'm thinking, how it's not a case of why should I do it? It's never the case. It might is how am I going to do it? Alrighty. And everyone gets frustrated because I'm constantly at it. Poor Sally, she's gone gray after joining me. Alrighty. And the team as well.
She's remarkably non-resistant herself, it seems like. She's a good partner in this whole project.
Yep. So she's somebody that I delegate to because I know I can trust her. And so her personality is like, let's do it. All right. If somebody's called for help, can you call? Can you answer the question here? Sally, I've got patients here. Oh, lunchtime. All right, let's do it. Let's fit it in somewhere. So it sort of merges and it blends into one thing. And I think it becomes like, how it is. The best example I can think of, when the river meets the ocean, alrighty, there's a bit of waves and stuff, but after that, you can't tell the difference. It all becomes one. And then there's harmony and it just flows and you have waves that come across. Yeah, but you ride the waves, The question is whether you're on a surfboard or you're in a big cruise liner or whether you're in a small dinghy, you just feel the waves differently. That's all. And then you just keep going with it. So, meaning I think I'd like to say this is it. I'm not going to shift out of it. I guess where it does affect, if to be totally honest, again, is family side does get affected, but I've got an amazing wife and a daughter who have given me the freedom to say, spread my wings to fly. It does get tense at times. We're human. Alrighty. Say, are you going again? You're extending it for another week? You never told me. Oh, sorry. Alrighty. But, then you try and do the best you can when you're back, and so it's all about how can I help somebody else a little bit, if it's one little bit. And I guess so for me, when I try and help people, I'm thinking all I'm asking is, can you tell somebody about how I've helped you so it will help us? Because we're a small course provider. So that's why if we had 300 students or 80 students or 50 students, I wouldn't be able to do what I'm doing. Alrighty. Meaning I'd love to, but if somebody knows a way to do it without, cloning myself, but that's where the difference is, where everything is one-on-one, everything is personalized. And so I guess that's what we try and work towards is we help you. All we're asking you is let somebody know. And that's how it's when we were doing our stats, we looked at it, I think 40% or 50%, some years even 60% of our candidates who've come in have been through word of mouth.
Wonderful.
All right. So it's only been recently that we've started to advertise, and that's because we know working with different people who market, you've got, I never wanted to be in front of the camera. Even this now is like, oh, all righty, how do I do this? And I said, do it. All righty. People need to know what we do, all righty, because what we do is a good thing, and I think it's helping people. So that's the main thing, Otherwise, I'd be behind the camera and I'd put Sally here, and I'm sure we'll get Sally on board as well. But I think the main thing is, hey, we're here to help. We would love to help, and whatever we can. If we can't, we'll point you in the right direction as well.
Wonderful. I am trying to get Sally on the podcast just to talk about her her career within dentistry.
She needs to work on it. All right.
Pardon?
She needs to work on it. She's like a deer. She's literally like a deer in headlights. So she's doing personal training to talk and stuff like, Sally, just go and be yourself. All right.
Yeah, that's it.
So,
that's it. Yeah.
But people get nervous.
Yeah, it's in the doing that we broaden our experience and get the confidence around. There's no fast track to confidence. Or there's no fast track to competence, I should say. We just got to do the work. We can fake it till we make it to a certain degree, but we've got to be competent at what we're doing. From the perspective, I agree. I think the world has become very focused on the what's in it for me rather than what can I do for the world and what impact can I do for the world. There are books and quotes the world over millions of times indicating when I started giving back, what I got back with tenfold, 100-fold, 1,000-fold. The kind of work that Amin and I are doing in Dental Business Mastery, we've started to identify increasing levels of work that we can do with dental team members because we personally have gained enormous fulfillment from our roles within dental practices.
Awesome.
You are gaining enormous fulfillment from extending out your reach, your network of who you can actually positively impact with the Advanced Dentistry Institute as well. And when we can, we recognize there's a what's in it for me. Sure thing. If you go along and do this course, you'll be able to upskill yourself, come back, have a stronger impact on your own career, your own income, the type of practice that you want to eventually have one day, or the impact you have in the current practice. That's all there. But when we're talking about dentistry, like any other health service and like many other professions that are around, but speaking about dentistry, that's what we're in, the amount of impact that you can have on patients when they go down this path can really start to build a great level of fulfillment in your own career. Have you found that with your specialty?
Absolutely. There's no short answer. So, it's interesting you said about how we give back, and you just alluded me to something. So, I've always wanted to have an impact outside of dentistry, all right, not just what I do. So, the way we've designed the course is the course fee. So, patients who could never afford implants. So initially the course fee covered just the cost for the implants. The patients had to find the money or borrow the money to get the crowns done because they're low, the part of India where they come from. So now we've structured the course in such a way that the course fee actually covers the cost for the implant and the crown. So they have no out-of-pocket cost.
Wow.
So these are patients who would never be able to afford it, but always wanted to. All right. These are patients who've been embarrassed to walk around with a denture, had never had the confidence to go out. We're giving them something fixed. All right. So that helps from that perspective, but that's one side. So what we've also done is ADI actually supports a girls' orphanage in India, all right, where we support as best as we can. So this is only for girls who've been rescued, who've been orphans. So they're primarily orphan children. Alrighty, and we support them the best we can. So whatever we do, a small percentage of our profit goes into that, giving it back, and that just helps, for them to buy beds, or we sponsor meals for them, and these are the kids who've never eaten chicken on a daily basis, so having a chicken meal, is like a treat. Having an ice cream is the laughter in the orphanage. So there's around 96 kids in the orphanage. Alrighty, the laughter in that. So recently we took an orthodontist who came with me, who's a senior orthodontist here in Australia. He came down and we took him to the orphanage, and he's a stoic person. Alrighty, no missing. He got back, finished there, got back into the cars, and his assistant said, I have not seen him break down like he did in the car.
Wow.
Alrighty. So he runs all the programs here in Australia. So he has now said that a portion of our profits are going to the orphanage. It always has to be more than us,
Yeah.
because it's all about legacy. It's all about who else do we help. It's not about a name for ourselves. I don't want, so the girls in the orphanage do not know anything about ADI. All right. It's not about ADI. We just go there, we give help out financially, and then they say this is our need, and then we say, all right, this is what we can do to help you. Maybe small, whatever it is, but we do that. As long as I find that's the social side of the impact. But also in Adelaide as well, every year we try and find one person who is struggling financially, and then I talk to the surgeons and who I work with, and we try and do an all-on-4 case for them completely free of charge. All right. So we try and give back whatever we can. Yes, it does affect the hip pocket, but hey, wait a minute. We're so blessed in Australia with how much we have. We don't realize how tough people do it outside, and so that's the whole challenge. That's what we try and do, a little bit of what we can, giving back wherever we can.
And I think you've hit the nail on the head there. We don't actually understand the impact that we can have, and we don't recognize how much some people do struggle. I came across an episode of Insight years ago, and it was called The Dental Gap.
Okay.
And they had dentists and patients in desperate need and all sorts of people within the audience. And what it really highlighted to me, because people were standing up and either due to money, fear, severe drug addiction, also all the reasons why they can't front up to dental practices ever. And they've got a dentition which stops them from meeting new people, stops them from going for a new job. Their self-confidence is down. They no longer smile in pictures. The impact,
Yep.
knock-on impact for a human being when they have got a destroyed dentition or one that they feel ashamed about is so profound and extraordinary to me. And I thought to myself, one of the takeaways that I had when I watched that Insight program, and we encourage all of our students to actually watch this as a dental group when you go back to your dental teams, because we all need to understand that it is, and I understand why, but we think that the situation or the difficulties that people have with dental is exhibited by the patients that we see coming through the dental practice. That is a percentage of the population, and there is a substantial percentage that never front up to us. We never get to see the impact of if we weren't even here, if the professional wasn't here to look after people. And in order to really tap into and identify the purpose, the deeper purpose that makes us get up every day, and regardless, we're going to go there because we're having that kind of impact, we need to really look at levels of communities that don't have access to any of that and the impact it has on their life.
Yeah, absolutely. The variation in people that we see is, like you said, is a small percentage. And I guess that's why dentists always, the group of patients that we have to work with is this small, but I find that if you start giving a little bit of yourself, then the patient pool starts to spread out. It's always harder, especially in tough times, to be able to do that. But I find the more we do it, or even the little that we do it, the sense of fulfillment, the sense of peace, if that's the right word, whatever you want to use, because I think one of the things that I was taught when I was young was we came with nothing, we're going with nothing. So in a way, there's no point in building up $1 million bank balance the day we die. Yes, you're going to give it to your legacy for your kids and everybody else. So, even that, is I might as well try and help as many along the way so that down the track, you're lifting people up. You're not lifting like this. So what we want to try and do is lift people up like that, so there's a bigger pool. So it's almost like you spread your arms around or you stretch your hand forward. When you spread your arms around to hug people, you can hug more people. But when you stretch your hand forward, you can shake only one person's hand.
I love that. I love that. That's right. Because legacy can be just restricted to your own instant family and that's it. Or it can be broadened out and start to impact.
And there's nothing wrong with that, but
correct.
Yep.
Correct. Nothing wrong with it. Absolutely. That's for sure. And I suppose that circles back to Buckminster Fuller. Do what you see is
There
needed
you
in
go.
the world, even if you don't get a buck for it.
That's it, okay.
So if there are people out there that are intrigued to find out more, what is their best next step?
The best next step is just to go to the website or give us a call. I think the easiest is going to the website. There's different options. People get confused. Just give us a call, have a chat with Sally or have a chat with myself. And if Sally can't answer the questions, then she'll get me onto the phone and I have a chat with them. I think that the first step is pick up the phone, have a chat, or go to the website. Send us your inquiry, and then we'll get back to you. And then I guess the main thing is see how we can help. I think we can help everybody at whatever level of their journey is. It's just a matter that we only have few spots, alrighty. And so, like a group of 4 people come, our batch is full.
Yeah.
So I think that, and again, people have said, why don't you increase your batch size to increase your profits? But it takes away from the one-on-one concept of what we started for. And so I'm still sticking to it, and I get told off each time I have a chat with Angus. Alrighty, you need to grow. Alrighty, but
Love it.
we just stick to it at the moment, and we'll try and see how we work it and increase the numbers, and then go from there.
And you're getting outstanding income, outstanding outcomes from sticking to that concept. And from what are you the only one? Is the ADI the only one that's actually offering that one-on-one mentorship and the level of support you provide post-graduation?
And I say this as a disclaimer, as far as I know.
As far as you know.
As far as I know, we're the only ones who are doing it because it isn't profitable. So I'm just putting it out there for people to say course fees, discount, all of that. It isn't profitable, and that's why people don't do one-on-one. Alrighty, it's a stretch. The profit margins are really tight. Alrighty, especially because I have to shut my practice. Alrighty, I have to leave and come there, for 5 days. And then we are restricted to 5 or 6 candidates in a group. In multiples, profit multiply. Alrighty, but we've kept it to that. So and then I'm away from home, all of that. So I think as far as I know, we're the only ones who do it. But a lot of other courses, they all do a great job. There's no question about it. But I'm thinking if you want somebody to take you to the next level of confidence and being able to say, hey, I can do this. I'm confident to be able to do this. I'd say give us a chance.
I love it. I love it. Thank you so much for giving so much time for this interview today. I'm totally delighted.
Thank you so much, Julie. It was a pleasure. Thank you so much.
Fantastic. And all of the links, phone numbers, website details are in the show notes. So if you are interested, go on down there and have a look. And if you've done the course and you've got great outcomes from it, then talk it up. Get online and talk about what a great experience that you've had and really help ADI have even more impact than what they're already having. Good luck with everything that you do in the future.
Thank you so much, Julie. It's been a pleasure. And
thanks, Yohan.
What you do is great work. Thank you.
Oh, you're kind. Thank you so much. If you enjoyed this podcast, then I encourage you to head over to Amina and my website, dentalbusinessmastery.com.au. You will find all the information that you need if you would like to gain our assistance in helping you and your team achieve great success. If you would like to find out more, you can also email us directly at info@dentalbusinessmastery.com.au. Thanks so much for listening.